current and future physiatrists on what it means to be a unified, connected specialty and to benefit the entire healthcare community.
We are more than, because we are clinically diverse. Physiatry is more than one organ, more than one limb, and certainly more than one condition. The scope of our work is defined by our patients' never-ending drive and search for a fully functional life, and our passion to help them succeed and exceed beyond the quality of life they ever imagined possible. Whether you're focused on brain injury, pediatric rehab, neuromuscular medicine, sports medicine, or cancer rehabilitation medicine, our roles strengthen, and I mean strengthen, our specialty and the impact that we have on our patients' lives specifically, and actually the entire field of medicine.
We are more than because our scope of care is not limited to an exam. Did I miss something? In August, we had dozens of physiatrics members supporting the athletes of the Rio Olympics, monitoring their performance and supporting them in their pursuit of goal. We have physiatrists leading the training and development of the future physicians of our specialty. Their work is critical to the feeling of connectedness that all physiatrists have, no matter the specific focus to the specialty of PM&R. They also greatly influence the scope of our specialty in the future of medicine. We also have physiatrists in private practice, lifting the entrepreneurial spirit of our specialty during times of great change and mandates. Our broad application of care make us adaptable and impactful. As long as we are unified in purpose, together we can use this as a strength in the future of healthcare.
We are more than, because our spectrum of care is not limited to one point in time or one age group. In the video, you saw a diverse representation of patients treated by physiatrists. There was no way to capture all of it, as I'm sure you all can understand. However, our patients and their stories reinforce what is at the core of what we do, patient-centered care. In physiatry, or physiatry, I firmly believe we reinforce the 3 A's of starting practice: affability, ability, and availability. Obviously, ability is what lasts. It is sometimes difficult to see because of our spectrum of care, but unified, we can reinforce the values of physiatry that physiatry offers. Unified, our impact is intensified.
And so, our specialty is incredible. So we want you to help us celebrate and be unified in all the things that we do and the impact that we have as a specialty. Together we are going to create a stronger specialty with a greater impact. So this week we want you to join the campaign. How would you complete the sentence, "Physiatry is more than"? So please stop by the Member Solutions Center, where there's a large wall where you can write your answer to that statement as well, and we want to hear from all of you. And when you leave today's plenary session, please get a t-shirt from one of our peers on the way out. We want everybody to wear these t-shirts on Saturday to celebrate Physiatry Day and help us make a statement. We are diverse in practice and clinical expertise, but we are unified in our uniquely valuable focus to maximize function and the quality of life. We, physiatrists, united as one diverse specialty, are more than. Thank you. Well, I have one more duty to do, and that is that I have the great honor to introduce our current president, Greg Worsowitz. So, Gregory M. Worsowitz, MD, MBA, he received his medical degree, he's a Southern boy, received his medical degree at the University of Florida, and his PM&R residency was at Baylor College of Medicine in the great state of Texas. Greg is now the chair of the Department of Physical Medicine and Rehabilitation at the University of Missouri School of Medicine. He has a particular interest in looking at post-acute care and policy in that area, and he's been the medical director of post-acute care for the University of Missouri Health System. But the other things I want to say about Greg really don't have anything to do with his qualifications. Well, maybe they do. I want to say three things about Warso. First of all, he is an incredibly warm personality and a good friend to all who meet him. Secondly, he really is a personification of unwavering commitment to physiatry throughout his career, mentoring, teaching, and volunteering. Just great. And lastly, he has an unwavering focus as well on our patients' quality of life and function. So I'd like you to help me welcome Greg Worsowitz. Go Tigers!
There you go. Thank you. You're fantastic. ZOU. There you go. First of all, I want to thank everybody for coming, because without you, and physiatry is more than me, it's more than one person. I think physiatry is all of us. And with that being said, I have to recognize all the past presidents. I know we did things differently this year, and many of you have served as my personal mentors and the work and time and effort you've given. So let's hear it for all the past presidents. Thank you. Anybody that knows me knows I can't stand behind a podium and not move around, so bear with me. Although, there you go. What can I say in 15 minutes? Probably the best thing is not say anything so we can bring our guests on, but you have to bear with me. Yes, change is happening, but when change is happening, there's always big opportunities. And as a result of that, over the past couple years, your academy has changed, and many of you have been part of it. And one thing I will say is advocacy for all. We need to think about that unity and what is physiatry. It is not just one area of our practice. It is all of us, and function in the patients we serve. So healthcare is changing. We know the big wave. We've talked about ACA, MACRA, MIPS, APMs. How many people here know what all those acronyms stand for? Oh, then you can go home. You don't need to be here. And we know we've seen consolidation of healthcare systems, of physician practices. We know those that work in post-acute care have seen changes, and we're going to the value-based medicine. Maybe none of these are bad things, they may all be good things. It's how we ride the wave of change that will determine how we all serve our patients. So what are the big changes? Payment. Anybody here worry about payment changes? I mean, because we need to be paid to be able to care for our patients. Regulations, anybody worried? I am. Models of delivery of care. How do we deliver our care, and how is medicine practiced in the future? There we go. So how has our academy changed? Well, one is education. I think Andre came up and talked about we're trying to change some of our platforms of education. Some of the content. We've always looked at the science of caring for patients, right? Well, now we got to start thinking, what is the science of how we run practices? What is the science of how we meet macro regulations? What is the science of how we do our work? A couple things the Academy is doing. One is a registry. If you haven't heard about it, we're working on a spine registry. I encourage you to learn more. I'll talk some about that. We're changing how we do our strategic planning. Rather than just sitting in a room full of, 12 board members, and if you're worried about me trying to do it, we're in big trouble. if you let me try and develop your strategic planning. But we're going out and asking everybody. I encourage you to stop at some of the forums, some of the